as we've done in the past, we're just going to combine things. So we're going to go flexion just above 90 degrees, adduction, and then we're going to internally rotate there.
Yep.
You feel some pain?
Yep.
How would you describe it?
Like it's being pinched.
Okay. Kind of pinchy, stabby, sharp, or whatever. Yeah. So, still there?
And even more so, yeah.
Okay. So she's got a positive result, or positive test for the FABER. So a little bit of impingement. Now again, what's causing that? We don't know. Is it misshapen femoral head? Is it misshapen acetabular fossa? Is it a muscular imbalance issue? We could do muscle testing to compare the left hip to the right hip, see if there's any significant difference. Can we have you actually turn on your belly? Be curious to see if she has laxity in the anterior hip on the left, then that may be a little contributing factor to, again, the ball drifting out of the socket a little bit. Okay. In which case, if she has anterior hip joint laxity, her hip extension on this side is probably going to be greater than this side. Okay. More commonly, there's going to be too much tightness or shortness on the front of the hip, and that's usually what jams the ball into the socket. So we'll look at both. We'll look at that with the Thomas test. So we're going to see how far we get hip extension here. Right about there in the hip joint, so that's pretty typical, about 10 degrees. I'll swing around this way. About the same. This one feels a little stiffer as we get to the end of the motion, which suggests a little more tightness on the anterior hip on the left, which is more common with impingement. So let's have you turn over. Actually, I'm going to have you spin around so we have just a little bit more room. So legs on this end. Let's move into the Thomas test. So we're going to look at the length of her hip flexors, and we're going to differentiate between shortness or tightness in the iliopsoas, the rectus femoris, and the TFL. So I'm actually going to have you scoot down towards the end of the table so that your glutes are about halfway off the edge. There you go. All right. And then go ahead and bring both knees up. Hold your left knee if you would. And then let this leg come down. So what we're looking at for the iliopsoas is how the femur sits. Okay? If the femur is below parallel, that's considered a normal length on the iliopsoas muscle. If it's higher than parallel, that would be a really tight iliopsoas muscle. Okay, so at least on the right hip, Becky's iliopsoas looks okay. It's got a normal length. Okay. For the rectus femoris, which is one of the quads, the only quad that crosses the hip joint, what we want to look at is the angle of knee flexion. So if the rectus femoris is tight, crosses the hip, it's going to pull on all the quadriceps by way of the shared fascia or connective tissue, and it would create some knee extension. Okay. So for Becky, her rectus femoris looks like it's got, again, a pretty reasonable length. We want to see at least 80 degrees of flexion at the knee. If this is 0, straight up and down is 90, she's at 90, her rectus femoris looks okay. Okay. So no tightness or shortness showing up there. Good on those two? Hold on. You doing okay?
Yeah.
Okay. The last one is looking at TFL. Again, TFL is our flexor, abductor, and internal rotator. So if TFL is short and tight, it's not going to flex the hip. What it tends to do is pull the hip into abduction. So the knee is not going to be in line with the hip. And if we look like right at the top of the hip joint, we see that her knee is coming laterally. This would be a little bit more of an ideal length for TFL, and then relax. So those TFL fibers are pulling her slightly into abduction. Okay, so a little tightness there. Go ahead and have you switch. And let's see what we see on this side. How's the iliopsoas look? Again, parallel's kind of middle of the road. If it's above parallel, it's too short or too tight. Below parallel, it's normal. Looks all right. Okay, so nothing standing out with the iliopsoas. Rectus femoris again, we want to look at knee flexion, so about 80 degrees, right? This would be closer to 90. She's right at about 80, right? Just a little bit less than 90. So her rectus femoris looks all right. I don't know how well you can see it from where you guys are, but how's that TFL look? It's pulled out, yeah, it's tracking more laterally than the right side. So that would be a little bit more ideal. And there's the left side, okay? All right, you can go ahead and come up. So, we've got a positive result for TFL tightness or TFL shortness. Right? That could be some of what creates that discomfort with on the FABER test. Right? So we'd want to treat that either directly, or you can think in terms of the stomach and gallbladder out here, and then if that treatment of that pathway then decreases the hip pain on the FABER test, we're on to something. If not, it may actually be a bone-on-bone issue, right? A true impingement issue. Okay. Questions, thoughts on the Thomas test?